Hi everybody, it's Jackie O'Doherty, and today I'm answering a question from one of my clients who asked what can she do for the pain and inflammation that she feels in her hands. And this is such a common question that I frequently get from people, and so I'd like to share with you what I do. As you know, I'm not a doctor. I'm just a fitness instructor with a biology degree, but years ago when I was getting certified in Swedish massage, they taught us how to take care of our hands because we would use them so repetitively. So I'm going to share with you today a technique called ice massage, which is fantastic for the hands and the muscles in the hands. But before we talk about that, let's talk about what causes inflammation in the first place. And guys, it's only one of two things that causes inflammation. It's either what we're doing with our body or what we're putting into our body. So when we talk about what we do with our body, we're talking about repetitive use, habitual strain without enough rest and repair. So just become aware and gain your own insights as to how you're using your arms and your hands through the day, and make sure that when you're not using your hands that you're keeping them relaxed, loose, and no pressure on them, especially when you're sleeping at night. And so when we talk about what we're putting in our body, we're talking about all those things like white sugar, white flour, fried foods, and dairy, everything that inflames our systems. Gradually work on eliminating those from your diet and you'll feel much better. So now let's go on. I'm going to demonstrate for you the technique of ice massage. Okay guys, so just a quick word of caution before we start. Ice massage is contraindicated for people with Raynaud's syndrome. So before starting anything like this, it's always a good idea to check with your doctor and make sure that this is appropriate for you. Okay, so let's get started. What you'll need for this is you'll need a large bowl, unless you're doing it over the sink. You'll need about 3 to 6 regular sized ice cubes, a small amount of water. You'll need a dish towel that isn't very absorbent. You'll have to have something to hold the ice cube with so that your hands don't get too cold. And then you'll need a warm, fluffy towel to dry off with and wrap your hand up in after you're finished. Okay, so I'm going to go ahead and put 3 ice cubes in the bowl. And depending on how warm it is where you live, you're going to need more or less ice cubes. I'm going to start with about 3. Go ahead and remove all jewelry and roll up your sleeve. Take the dish towel and grab one of those ice cubes. Now you're going to notice that the shape of the ice cube is really conducive for rubbing the hands. Lots of times with ice massage we use a styrofoam cup with water filled in it, and then we just peel back the styrofoam cup and we massage the ice with the styrofoam cup, but that's a really large hunk of ice. When you're massaging the hands and doing ice massage on the hands, you want to use these ice cubes, this size ice cubes, because it's just perfect for getting into the joint spaces. So what I'm going to do is I'm going to start with light pressure, really light pressure, and moving rapidly. You want to move the ice cube around rapidly, not, don't ever hold it still in one place for too long. You want to make sure you're really moving along and just making contact now. You're just making contact, getting all the surfaces kind of cold. And make sure you get the sides of the fingers too, the back, front, and sides of the fingers. Another great spot is right here on the thenar pad and the thumb web, and all in through the palm of the hand. And as you rub the ice cube, you're going to feel it going through. You're going to feel your skin going through stages. It's going to feel cold at first, and then it's going to feel burning, and then it's going to feel just maybe slightly numb. It's uncomfortable when the ice cube when you first start rubbing, but then you kind of get used to it. And you're not going to do this for any more than a few minutes, just a few minutes, guys. It's really all it takes. Okay, I'm going to drop this ice cube. It's melting too much. I'm going to go on to the next one. Great. All right, flexors and extensors time. So going through the extensors, same thing. Make sure that you're moving it rapidly along your forearm, all the way up, lightly on top of the wrist, On the other side, completely avoid your pulse point here, but rub up higher all along your flexors, along the inside of your forearm. Okay. As you do this, you see how there's red, it's going to be blood flowing in there. Okay, and that's about it. That's about it. I'm going to stop that. Get your towel, the warm fluffy towel. Dry yourself off. Put your sleeve down as quickly as you can. You want to make sure you cover up now. Keep it warm. And wrap the hand up for just a second to keep it warm. Okay, once your hand is nice and dry, what you're going to do next is you're just going to massage the hand with your other hand. Along the palm, thenar pad, thumb web, and then you're going to milk down each finger. When I say milk down each finger, it means you're going to start here and just work your way through each one, all the way through. Now you're going to be amazed at how this makes your skin feel too. The skin will actually feel softer. You're going to feel like you put a ton of moisturizer on your skin, and all you did was rub it with an ice cube. All right, on the side right there. You can knuckle through the palm, rub your hands together, and that's it, guys. Okay, make sure you rest that hand for the rest of the day. I only recommend doing one hand per day. So if both hands are bothering you, pick one to work on first. Make sure you rest that hand for the rest of the day, and then work on the other one the next day. So if you're a musician or a surgeon, make sure you clear your schedule for the rest of the day. No more with that hand, just rest it, okay? So I hope this was helpful for you guys. Try it out and see what you think.